do you think about all of what we're hearing about in the news? Will these plans work?
Well, it's a question of whether they're working or not. We clearly need more transparency around pricing all the way across healthcare. I hope that will begin to put price pressure on and increase competition.
We've been hearing about this for so many years. I feel like I've been talking to you about this for the last decade. Price transparency, making sure that the consumer knows what they're about to get into, knows what they're responsible for. How come it's taking so long?
Well, I think a lot of things takes a long time in Washington. I think it's just a matter of pressure and a lot of pushback by a lot of pharmaceutical industry and individuals. I think, I would just soon not see advertising on pharmaceutical drugs on television at all. And if you're going to do it, I think you got to pair it with pricing because we have all the complications with it. Frequently, people come into the doctor and just say, "Look, I saw an ad about this on television last night. Are you going to get me that drug?"
Because those people looked really happy in the ad?
Oh, always.
Yeah, right.
How do you feel about pricing that for services? I think listing it in the same way. You walk into the doctor even before you get to the doctor, or they say if you're going to take this blood test, it's going to cost X. If you're going to do this test, it costs whatever.
I think that's where we ought to go. I think we have the transparency around quality, and we've worked hard at having that. We do not have transparency around cost. But it's not a simple thing to do it. For example, if you go to the emergency room and you got a stomach ache, who knows whether it's appendicitis or you've got, flu.
Right.
And that's the problem where you get into with cost.
There's places like, Andrew, you ran into this when you wanted to go get, I forget what sort of screening it was, some test of using a machine.
Oh, the MRI.
The MRI.
The MRI without insurance, because I just hadn't had the insurance form filled out. They were going to charge $4,500 for an MRI. And I'm thinking, I know you got to amortize the machine here, but this is a lot,
Yeah.
But with
down
insurance,
down the street it'd be $2,000, right?
I think down the street was like $900.
Oh, there's no question about it, and I think that's one of the things you ought to have transparency about.
But doesn't this become about technology? For so many years, I've heard about Amazon, the ability of Amazon to disrupt industries, and that Amazon eventually will enter the healthcare space. They will utilize technology to allow for the price transparency that you're talking about. Why is technology not disrupted to this point, and how can they?
Well, I think that the technology, particularly around information, is going to be an enormous opportunity for us. Think about healthcare right now. The total amount of knowledge in healthcare, total amount of data in healthcare, doubling every 73 days. Huge amounts of data. Can't keep up with it. But on the other hand, that's the opportunity, because now you've got the data and you can begin to analyze the data and find things we never expected we're going to see before.
Is that what Google's doing right now, too?
That's the machine learning. Yeah. I mean, the things that have come from machine learning are amazing. You now see that you can do voice recognition and tell whether somebody's on a drug or not. You can do a retinal scan and make 60 diagnoses from a retinal scan, all automated.
Really?
So this got huge opportunity.
What kind of diagnosis can you do from a retinal scan?
Well, everybody who's diabetic ought to have a retinal scan every year. No way that you possibly got enough ophthalmologists in the world to do that. So now you can do a retinal scan and look for the findings of that get diabetic retinopathy all autonomously.
How many things can you find out?
60.
Is this Elizabeth Holmes' new company?
No.
Oh, okay. Are you sure this works this time?
Yeah, it's being used it was developed in London at the Moorfield Hospital, there, the eye hospital.
Retinal, huh? That's interesting.
And just take a picture of your retina. Exciting stuff.
But will we get to a place where I'll be able to go onto a general marketplace like Amazon, and to Andrew's point, Andrew needs to MRI, he wants to know that when 10 miles, there's one for $4,500. Within 15 miles, there's one for $3,800.
Yeah, in fact, that's been done by some startup companies that have tried to do that, and it just has not gone across a wide swath. You could tell in San Francisco, for example, how much a mammogram costs across a whole bunch of places, and try and direct people to that spot where it's cheaper, less out-of-pocket costs.